If I had one piece of advice for somebody dealing with knee pain, initially you can try to treat it yourself, right? Treat it with some rest, ice, compression, elevation, anti-inflammatory medications, maybe some ibuprofen or Tylenol. If the pain persists and is not getting better after a week or so, then you need to seek professional evaluation. The knee has three major compartments: the medial compartment, the lateral compartment, and the patellofemoral compartment. That all can be replaced. And in a total knee, all three are replaced. In a partial knee, you're specifically talking about only replacing one of those compartments. The idea behind it is if the problem is primarily in one compartment, why replace the whole knee? Just doing one compartment, 2/3 of the knee is left alone. So it's their normal native cartilage, their ligaments are left intact. So they get those normal impulses sent back to their brain like a normal knee, and it feels like a normal knee to them as they use it. If you're doing this in a very young patient, say in their 40s, you're giving them back quality of life, allowing them to stay active. So if they want to run or jump or ski or play basketball, they're not really restricted in doing that with a unicompartment-only arthroplasty. There's not a big downside to it because if even a unicompartment-only fails, most cases can be easily converted to total knee replacement. 50% of getting better involves the patient being able to perform the physical therapy and do what's needed to recover correctly. It's you getting up, getting out of bed, getting your range of motion back, getting your strength back, mentally make the decision, hey, I chose to do this, I'm gonna fight through it, I'm gonna get better, and I'm gonna have a good result. And those patients do great.